Slovenia ranks first in the European Cancer Screening Policy Index. We try to balance, on one side, the innovation and the rising cost with the equitable access to treatments by everyone. It's about combining our power, combining our data into a bigger databases. The cancer incidence rate has actually doubled over the last 20 years.
Hello everyone, welcome back to OncoDaily, and today it's a great honor and pleasure for me to welcome the Professor Valentina Prevolnik Rupel, Minister of Health of Slovenia. Thank you so much for being our guest, and thanks for finding a time in your busy schedule. You are an economist with a deep expertise in healthcare outcome measurement and value-based care. Your doctoral degree is focused on the impact of quality of life, priority setting, and the efficiency of resource allocation in healthcare. Why did you choose to work in healthcare from your early career days?
Yes, actually I did. I did choose healthcare. I'm an economist by profession, and when I had to decide to choose my specialization for master's and for my PhD, healthcare was one of the areas where at the time, when this was happening, so that was in 1994, there were not lots of economists working in healthcare as in a health policy. They did work in healthcare as accountants or in the costing, but not really as in healthcare policy. So I thought that there is a specific space for this in Slovenia, and I think I'm also the first economist in Slovenia who chose specifically this direction. During my master's and my PhD, I also went abroad to the UK to get some additional knowledge, because the program of health economics was not developed in Slovenia at the time, but I was very interested in healthcare because I find it a very complex system which needs really broad understanding of issues, but has lots of contents that is economically challenging, like what interventions bring what value and things like this. Also, we have to always invest in quality of care, which has its price and its pluses and minuses. So there is always lots of question: how can we manage the risks that increased costing brings, and how can we, in spite of these higher costs, always assure equitable access to everybody. So I found it very challenging, and that's basically why I chose this path.
Thank you very much. Very interesting. Can you explore a bit more your career path? I mean, what did you do? I have read your CV and many others, I'm sure, as well, but would like to hear from you. I mean, how this experience evolved and how later on it shaped your views on the healthcare structure and healthcare vision.
I start after I finished my degree, so my bachelor's at the Faculty of Economics, I got employed as a researcher at the Institute for Economic Research. Institute for Economic Research has a very strong social policy department, and other social policies like pensions or social care were already covered by a researcher, whereas healthcare was not. So basically, there was a space for one researcher who would be interested in dealing with healthcare from economic point of view. So I started my master's and PhD in this area on how to allocate resources to optimize the healthcare for patients. At the same time, I got involved with the Euroqual organization, Euroqual Foundation, which developed by the time EQ5D instrument for measuring, which is a generic instrument for measuring quality of life, connected to healthcare, of course. So, all these coincidences somehow led that I started doing the research in this area. Also, I made connections at the Institute and with other European countries. So many projects evolved in the framework of Horizon projects, like on European level, but also national projects were somehow when we got a bit recognized, all the hospitals and the system also somehow saw that such research is needed. Then I traveled a bit because I went abroad for a few years. I lived in the United States for 6 years in London. In the meantime, I work at the our national health payer, which is the National Insurance Institute of Slovenia. Then I came for a short period at the Ministry of Health as well, because they had a department for economics at the Ministry of Health. That's where I first got employed. Then I worked here for a couple of years, went back to the institute, come back to the ministry again to work in a cabinet of the minister from 2010 to 2012. Then I went abroad again back to the institute, and then somehow I landed here. So it's a story, but I went to basically all stakeholders that do work in healthcare area. So it's for me, it's very important that I know the healthcare system from many different points of view. So, wherever I work with the providers, with the payer, or as at the regulator, or in research, I was always involved in healthcare. So I think that's quite an asset, that for 25 years you work with the different stakeholders and see how the healthcare, different stakeholders in healthcare see the healthcare policy.
Thank you so much for sharing that. About your key of success. What's your key to success?
Well, for me, it's very important that I listen, that people feel like they can tell their views on the healthcare system to me. Not that we always agree, but I think that it's very important that there are different points of view which can be somehow debated about or supported by the arguments, supported by the data. And basically, almost in all decisions, this is possible. There are rare decisions where we don't have data or we don't have our arguments, and you can just see from the practice what is going on in the healthcare system. But for most decisions, I think there are sufficient evidence and data upon which we should base our decisions. So I'm really trying to get involved with many stakeholders. As you know, Slovenia is also very supportive of this social participation. We try to involve everyone in whatever we make. Also, when we promote our measures, we try to get involved with the civil society, with the social partners, with all the professional organization, patients, to make all the measures more widely accepted, and because change is always difficult by itself and nobody wants to accept it, so we try to go as wide as possible and build solid argumentation and evidence to make it evident why the decision in a way it was made.
Since becoming the Minister of Health, what you would consider your major achievements and the challenges as well?
Major achievements. I've been minister now for 2 years. On October 13th, it was actually 2 years this year. So it's not a very long.
Congratulations.
Thank you very much. Yeah, but it's not such a long period because, for the first few months, you really although I've been in assista for so many years, but then you come to this position and you see that there are so many things that are new that you never knew about. So it's quite challenging. But still, we did prepare lots of legislation, and I think my major 2 points that I wanted to work on were, or major 2 goals, was to increase accessibility for patients and to once they access the services these services have a certain standard of quality. I would say that major achievement was, of course, that we were able to pass the Act on Quality Assurance in Healthcare, that we established an independent agency for quality in healthcare. So this is actually, it is dealing now with the quality indicators, with the safety procedures, reporting of adverse events, and also with the health technology assessment. So I think this is an area that was really lacking in Slovenia. We had some efforts, in each of the providers of each of the hospitals, and everybody tried to do something. But if it's not systematic on a national level, that it's not systematically covered, the benefits of such efforts are very limited, because there cannot be, the indicators are not the same, they are not comparable. You cannot get the comparison of good practices, and then the providers would not exchange the good practices. But now that this is achieved on a systemic level, we can work on it together, and I'm sure that the effects of this legislation, once we have the first batch of data collected, will be evident. We did also some very important steps, I think, in securing this public healthcare system, and we did lots of measures on the human resources. Also, in this year, we built a new system, or upgraded the system of payments for acute care, for specialist care, many models, and also in primary care. So that's quite a lot of work that was done on the upgrading of the payment system. In all the efforts, we tried to set the prices in a way that they actually reflect the actual costs. Why? Because we always want to make sure that providers decide which services they will do because they are needed by the patients, not because they are more profitable or less profitable, but that they really care about what patient needs. So I think that would be like the major achievements, but there are many challenges ahead, because the systems are evolving, they are changing all the time, there are new discoveries coming, the circumstances are changing, so it's always challenging, especially in regards to human resources, where I think the whole Europe has an issue with the basic demographic structure. So it's always a challenge, of course.
What about if we focus on the cancer field, cancer care? I mean, how you would describe the current cancer care and the oncology infrastructure in your country, in Slovenia?
Yeah, I think that Slovenia's cancer care has really developed significantly over the past 2 decades. The cancer incidence rate has actually doubled over the last 20 years, and it was increasing by 1.7% annually over the last decades. That's mostly due to the fact that Slovenia has one of the eldest population in the EU, and of course, eldest population is more susceptible to cancer. But despite this rising incidence, cancer mortality has declined significantly between 2011 and 2021 by 15% in men and 13% in women. And in this, Slovenia has outperformed many EU countries in reducing overall and avoidable cancer mortality. And for example, the avoidable deaths from breast and colorectal cancer were actually halved compared to EU averages. And I think this is the consequence of really effective and timely healthcare interventions that we have in Slovenia. Of course, we have like a major strategic framework. It is called National Cancer Control Program, and it includes many measures, mostly on prevention, how to avoid smoking, unhealthy diet, stress, more alcohol consumption, more physical activity, and things like this. And besides this, this National Cancer Control Program, it also includes screening programs. We have 3 organized national screening programs that would be breast cancer, colorectal cancer, and cervical cancer. And I think also in attendance, because we have this very specific approach, it's very proactive approach, is how to invite people in the screening programs. We are the first country, and according to the attendance in these screening programs among EU countries. So I think that the National Cancer Control Program is fully aligned with the EU's Beating Cancer plan also. And it's fair to say that also the involvement of the civil society is very strong, and we try to make sure that the all the care or the care planning includes patient perspectives.
Look, you are like an expert on the value-based care. And right now, when we're talking about oncology, with all these new drugs, but all the these raises in the prices, I mean, these are astronomical numbers. How you are able to navigate here? And I mean, what's your vision? How we can make this both do not stop the innovation, but also be kind of advocates for the value-based care? I'd like to take your professional approach on this.
Yeah, so the costs always rise. They've been rising for as many years as I can remember, and they will continue rising because innovation is really fast in the area of healthcare. And what we've always been doing is that we try to balance on one side the innovation and the rising cost with the equitable access to treatments by everyone, so by all the patients, because in Slovenia we have this universal coverage, healthcare coverage, so that almost, more than 99% of the population is included in the universal scheme. So what we need to really do here is to find value-based approaches. So we are not very strong in the data support, not just Slovenia, but Europe. So in this area, it's very important that we connect, that we combine the databases so that we really make those approaches available that achieve the highest value per euro. You know that WHO data is that 20 to 30% of all the services in the healthcare is not needed, or that they do not bring value to the patients. And this is where we have to go, to make it even more efficient, the system, using better databases, better modeling, better analysis on the bigger data sets, and to set on the other side, not just on the costing, but also on the quality of care, that we are able to measure it better. So that means including the outcome measures that matter more to patients. Still, it is unpleasant to say, but most of the healthcare system on the quality indicators, they are based on the indicators that are process or structure indicators, not the outcome indicators. So this has been only evolving in the last few years, but I think that it's progressing quite fast now. And also, if we all use the same outcome measures and to use them against the costs and then try to find the balance, that's the way forward. Because innovation will be fast, innovation, and the cost will rise. And if we don't do that to really, find the most cost efficient way, by including the outcome indicators that matter most to patients, then we will not be able to consume all the innovations.
Coming to from Slovenia coming to EU. I mean, what's your vision for the healthcare in EU, especially on the cancer field?
In the EU, Slovenia is, of course, cancer is one of the top priority for Slovenia. All the healthcare policy and the measures on the cancer. And if you probably but Slovenian cancer registry has been one of the oldest registries in Europe, not just in Slovenia. So we've always been working on this, to have strong data, which we analyze annually, try to change our measures, try to improve our policy to introduce the new measures that again improve the health of the patients mostly. So I think in this area where Slovenia is strong, it can offer also the experience to other countries. The second thing is that in the EU, that Slovenia is a small country, we are 2 million, can in many cases serve as a pilot country, as a pilot environment for new investments, for new technologies that are coming out. And then it's easier, if you have such a country for a pilot, then it's easier to, let's say, spread the results of the pilots to the other countries. I would say what we need to do here is to make sure that we have very strong digital infrastructure, very strong interoperability among the systems, and to be able to exchange data and best practices more.
I mean, congratulations with the registry for sure, I think, and this is very important that the small countries also show to the world that, small countries also, can be a place to learn. And this registry is certainly an achievement. And also, I would like to congratulate you on them. It's very rare when you are talking to a politician and the discussion is around the data, because usually, especially in our time, politicians like to tell the things based on the feelings so without data. So I congratulate you with that, really, for being so much data-driven. But I think also it comes from your profession and professional background. I would like to ask you also about the digital technologies, AI, with the current this emerging, not emerging, I would say even it's so fast, the pace of the for bringing the AI and these digital technologies to the healthcare. How do you see how the systems are going to change, in your opinion, and what's the role of Slovenia in the global I would say, digitalization?
Yeah, it's very interesting question. Thank you. Yeah, I think it's something that we are all very hopeful, but at the same time a little bit afraid. Because we don't know where it's going. In artificial intelligence, it's very important that we need to know that all the solutions are based, again, on good data. If we have bad input, then all the artificial intelligence, all the logarithms, they cannot produce good results. So again, it's about the data. And again, it's about combining our power, combining our data into a bigger databases to make better, basis for artificial intelligence. So I'm kind of pretty sure that artificial intelligence and digital tools it's probably possible to stop their pace of development. They will be here sooner or later. So what we can do is just to use them as best as possible. And also, in cancer, for example, I think that they will improve like the early detection or diagnostic precision, or also personalized treatment planning, but also treatment on this distance or remote patient monitoring. So we are kind of getting ready also in Slovenia for this, together with the Ministry for Science. Just recently, we made a survey among the providers of artificial intelligence logarithms and programs, and asked where they see the opportunities, in different fields, not just in healthcare, where to employ the artificial intelligence program. And the area which was seen as the most promising was exactly healthcare. Like almost half of the solution or the proposal were related to the healthcare. So just in Slovenia, for example, they had like 52 ideas where they could implement artificial intelligence right now. And it is already used, in this automated speech, or in organizing the schedules of the healthcare workers. So what we really need to make sure here is one, good data. The second, that we have really good legislation, and that we use it, in a morally correct way. It will be difficult. I'm not sure how we will achieve this. But in any case, we must go in this direction and protect through legislation, the ethics of use of artificial intelligence now before it's too late, because it's not going to be stopped because it's too good. It offers too good services in diagnostic way that we could anyhow stop it. But we have to make sure that we have the control over where the development is going.
Thank you. Going to the other part of our discussion about the equitable access to cancer care. I mean, how you are in concrete steps, how you are making sure that no one is left behind from the rural communities, from the older adults, other vulnerable groups. Are there any exact things you are implementing?
Yes, sure. You know that I'm very proud that Slovenia ranks first in the European Cancer Screening Policy Index. So I'm really happy that we remain committed to sustaining these screening programs, and we are already exploring further screening programs for lung and prostate cancer at this point. But in Slovenia, all the cancer care is covered by the compulsory health insurance for over 99% of the population. And even this less than 1%, is because they are changing the statuses. For example, if somebody is a student and then is looking for employment in this moment, they don't have a defined status, so that's why they are not employed. But if we have universal coverage, and cancer care is fully like 100% covered from the social health insurance, also for unemployed, homeless, migrants, and so on. So from this point of view, like from the financial risk, we have the costs are covered. Of course, there is always the issue of education. Like we know that there are differences between level of education in the access to the health care. And through this year, we passed the strategy for health literacy, where we try to increase the health literacy among citizens and health providers, also through actions and activities that we will carry out together with non-governmental organizations and patient representatives, where we try to access whatever barriers exist and increase health literacy. Here I would also like to mention that one of the Europe's beating cancer plan was to address fair access for people with a history of cancer to financial and insurance products. And in Slovenia, I'm very pleased that in Slovenia last year we passed the law on the right to be for the cancer to be, or the history of cancer to be forgotten for people, so that they have equal access to financial and insurance products than everybody else. So I think this is a step forward also to ensure the equitable access to care and to everything that is, that matters in life.
Thank you so much. A few quick questions, but very important ones. Who are your mentors?
I mean, in my life, I work with many people that really inspired me on transferred knowledge. But if you want me to mention specific names, probably there are two.
Why not?
Yeah. So one of them is my professor, Tina Stanovnik, who was also my mentor on my PhD, and he taught me loads of stuff about public finance and taxes and contributions. So thank you, Tina. And the second one for sure is Dorian Marušić, who is also still my advisor at the Ministry of Health currently, and who taught me lots. He's a medical doctor, a cardiologist, and he told me lots of things that would be difficult to learn for someone who is not from medicine or from medical field. He introduced and he kindly shared his knowledge with me. So yeah, thank you to both.
Thank you. Which books would you recommend everyone to read and that made an impact on you?
Honestly, currently I don't have really a lot of time to read books, but I love to read. Currently, I read books mostly, before I go to bed so that I fall asleep easier. And currently I'm reading the book by which I read actually for the second time because I love it so much. And it's a book by Catherine McCormack, Women in the Picture, and in the Pictures. It's about gender equality and how the women are seen from the artist's perspective in comparison to men. So I would just say, this is a really good book that comes first to my mind, and I would recommend to everyone to read.
Thank you. What would be your advice for the younger generation who are looking into the healthcare field and who want to become leaders in the field?
I would recommend them to go for it because it's a very interesting area. We need young people in healthcare policy. If they decide to do so, it is very important that they get acquainted with the field, that they get very broad perspectives on the area so that they can make a real decision, and as we said, based on data.
Thank you. If you had to describe yourself in one sentence, who is Professor Valentina Prevolnik Rupel?
I would say that I am, one sentence, that I am, let's say, result-oriented, curious, and I always try to stay to be positive and to stay positive.
Thank you so much. And the last question, who I should interview next? This is I'm asking always.
I would go for, she is also my friend, but I really appreciate always her advice, and I love talking to her. She is a professor at the Erasmus University in Rotterdam, Alice Tolk. She is very much familiar with the quality in healthcare, and I would recommend you to talk to her.
Thank you so much. It was just a very much pleasure talking to you. Thank you so much. I know how busy you are, and thank you for having a time for this interview. I'm sure the audience also is going to enjoy it.
Thank you very much for your time as well, and for the invitation.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.